What is the connection between MGD and dry eyes? Imagine your eyes as a well-oiled machine, where each part plays a vital role in keeping your vision clear and comfortable. One key part is the tear film, which keeps your eyes moist and protected. This tear film has 3 layers: the watery layer, the mucin layer, and the oily layer. The oily layer is produced by tiny glands in your eyelids called Meibomian glands. These glands secrete oil that forms a protective barrier, slowing down tear evaporation and keeping your eyes lubricated. When these Meibomian glands become blocked or their secretion quality changes, a condition called Meibomian gland dysfunction occurs. This is a common problem that affects many people, especially as they age or due to hormonal changes. When the glands don't produce enough oil or the oil is of poor quality, the tear film's oily layer becomes compromised. Without enough oil, tears evaporate too quickly, leaving your eyes dry, irritated, and inflamed. This process is a major cause of evaporative dry eye disease, which accounts for a large portion of dry eye cases. Studies show that up to 75% of people with dry eyes have some form of Meibomian gland dysfunction. When the oil layer is disrupted, the watery part of the tears can't stay on the eye surface as long as it should. This leads to symptoms like dryness, redness, burning, itching, blurred vision, and a feeling of grittiness. The relationship between Meibomian gland dysfunction and dry is actually a two-way street. While gland dysfunction causes dry by destabilizing the tear film, having dry eyes can also harm the glands themselves. When the eye surface is inflamed and irritated, it can worsen gland blockage or dysfunction, creating a cycle that makes symptoms worse over time. From a scientific perspective, the tear film's stability depends heavily on the health of the Meibomian glands. When these glands don't work properly, the increased evaporation causes the tears to become hyperosmolar, meaning they have a higher salt concentration. This hyperosmolarity triggers inflammation and can damage the cells on the surface of the eye, making the problem worse. Risk factors for both Meibomian gland dysfunction and dry include aging, hormonal changes especially in women, autoimmune diseases like Sjogren's syndrome, and environmental factors such as wind, dry air, or prolonged screen use. Because of their close connection, treating dry often involves addressing the underlying gland issues. This can include eyelid hygiene routines, warm compresses to unblock glands, medications to improve gland function, or newer therapies designed to restore gland health. In summary, the link between Meibomian gland dysfunction and dry eyes is rooted in the essential role of the glands in producing the oil that keeps tears from evaporating too quickly. When these glands malfunction, the tear film becomes unstable, leading to dryness and discomfort. Managing both conditions together is key to relieving symptoms and protecting your eye health. If you experience persistent dry eye symptoms, it's important to consult an eye care professional for personalized evaluation and treatment options.